Hi there, my name is Kim MacGregor. I am pursuing a master's degree in public health with an emphasis on nutrition. I did my final research paper on how living in a rural community affects a person living with a type 2 diabetes diagnosis. I chose this topic because I happen to live and work in what is considered a rural area of the state of Wisconsin. However, it is not just me who lives in a rural area. According to the U.S. Census, 97% of the United States is considered to be rural land. And unfortunately, living in a rural area doesn't just mean you're further away from cities and people and are typically surrounded by agriculture. It also means you're further away from critical resources such as healthcare. It is estimated that individuals living in a rural area are 17% more likely to be impacted by a chronic disease such as diabetes compared to those living in an urban setting. There are various reasons as to why the statistic is higher for those living in rural areas, but per my research, I found it commonly due to the lack of overall resources, the lack of education, and the lack of access to not just the resources, but access to transportation to get to these resources. There is also the concern of those living in rural conditions typically have lower socioeconomic statuses compared to those living in urban areas. Diabetes does require quite a bit of care and understanding of proper nutrition, physical activity, one's own body in relation to their A1C level or weight, as well as an understanding of what A1C levels even mean, including also a good understanding of their medications, what they're taking, how much they should be taking when, as well as finances to support these medications. Individuals without access to care and without the proper education on their health can often fall into high-risk categories where their A1C levels and or weights is too high, putting them greatly at risk for more severe symptoms such as nerve damage, blindness, or kidney failure. There are a number of things that can be done to help address these seemingly forgotten pockets of the country, and I hope that this project helped to address some of them. For this project, I worked with the Northeastern Wisconsin Area Health Education Center, or NUAHEC for short. It is a community health center funded through HRSA and the University of Wisconsin-Madison School of Medicine and Public Health. This area covers the whole northeastern area of the state of Wisconsin, but it is based out of Manitowoc County, which borders Brown County, home of the Green Bay Packers, go Pack Go, and Sheboygan County. The program of focus looks both at Manitowoc and Sheboygan counties primarily, as they are two of the more rural counties of this area. NUAHEC is one of many AHEC centers across the state, all of which are funded by HRSA and the UW-Madison School of Medicine and Public Health. NUAHEC hosts a variety of critical healthcare programs, one of them being the Chronic Disease Management Program that I worked with. The CDM program runs for up to 6 weeks each year, either in spring or fall or both, and it works with the local community health clinic called Lakeshore Health. Lakeshore Health has the mission of providing access to comprehensive integrated healthcare, regardless of ability to pay, eliminating disparities among the underserved. Together, these programs work together to fill any gaps community members residing in rural parts of the counties may face, especially for those with a type 2 diabetes diagnosis. The program works with a group of students from local surrounding universities in pharmacy, nursing, dietetics, nutrition, social work, and medicine, along with the participants' own providers. The aim of this program is to help the participant learn to better manage their disease and to teach them sustainable ways and skills by ways of prepping healthy, nutrient-dense meals, attainable exercise, understanding their medications, understanding their bodies in general, and just encouraging the patients to work with the healthcare team. One huge aspect of this program is a partnership with a local Meals on Wheels program out of Sheboygan County, where this program donates 5 meals, 1 per day, to the participant with recipe cards explaining what they are eating, why it is good for their health. And the meals are simple with hopes of them being replicated in the future. Cultures and specific diets are taken into account, which I believe is critically important for sustainability, but all the meals are carb conscious and low sugar, naturally and locally grown and sustainable. The short-term objectives are listed here on this slide that you can read word for word, but a lot of the objectives included engagement, as that is crucial to part of sustaining a program and creating effective change in a person's health. They have to be willing to not only work with a team, but actually do the work themselves. So one hurdle was getting the participants situated with their providers, which included the students who would be going into their homes as well as meeting them at the clinic. This objective was very successful, and while some participants may seem apprehensive at the start, they actually ultimately really appreciate and enjoy the close relations they make with these students who go into their homes. Some of the visits would also be done virtually via iPads secured through grant funding that the participants would be able to utilize while enrolled in the program. Part of this engagement also includes getting the participants comfortable with the technology and with the iPads and dealing with virtual healthcare, often referred to as telehealth. This is important as a lot of rural healthcare can be administered with the help of technology, and getting rural communities comfortable and familiar with this method can help diminish the barrier of limited access or limited transportation, as they could receive the care right there in their homes. Finally, the objective of having participants make an achievable goal for both their A1C levels and weight, as well as understanding why it is important to have these goals for their health and the impact it can make on them. This goal was based off current levels obtained by their lab work and is calculated with the advisory of their providers, so we know that they are safely and can definitely be achieved. The program itself is still running and in its final stages, so the end numbers have not been reported yet, but we can kind of guess that these objectives will be made just based off the current trends and how the numbers are all going down, and based off of similar programs in the program being ran last year. The original intent was to have 10 participants in the program, but we ultimately ended up with 6, which is still fantastic. These participants are chosen based off their current A1C levels, their weight, their med compliance, the location in which they live, and their willingness to participate. The Lakeshore Healthcare Clinic chooses the participants as they are all patients of the clinic, and they were identified, signed an agreement and consent forms, and then the program would begin after that. The initial meeting occurred in the clinic and involved meeting the student providers as well as had the patient take this baseline lab work. They also got introduced to the technology they would be using, got a lesson on how to use it, as well as got a schedule of when they would be receiving home visits, when they would be receiving their meals, as well as an overall debrief of the program. From there on out, participants met either virtually or in person every other week, as noted by the calendar. You can see an example of that on the slide here. At each visit, the students would respectfully work with the participant on certain goals, such as working on understanding their medications, learning exercise techniques that they can do in their own home given their circumstances, or assistance in prepping food, learning how to make lists, learning how to grocery shop properly. Each student would work with their specialty, and they would all work together to create comprehensive care for the participant, which curates an overall better outcome for their health as well as more sustainability for the program. The program's final visit is December 29th, 2022, so results are not collected until that time. So I do not have the final results, but we do have the baseline data that is shown here in these two graphs. We know that the A1C and the weight should go down, as we have seen in previous studies, as well as in the study from the spring last year, that weights did go down and the A1C levels all did go down and reduce that overall risk for diabetic complications. So we can confidently say that this program will be successful and show a decrease in both weight and A1C. There will also be a measure of satisfaction in the program, and this will be collected via in-person interviews, and these have yet to be concluded as well, but they will be shown via bar graph at the end, whether it was satisfied, very satisfied, neutral, dissatisfied, or very dissatisfied. In conclusion, lifestyle modification programs can be very successful if implemented in a comprehensive manner and over an extended period of time. Integrating technology into healthcare is especially beneficial to those residing in rural areas of the country where care may not be accessible. The program utilized various aspects of healthcare and addressed a lot of gaps that can exist. The primary gap, in my opinion, was the lack of nutrition and nutrition education. So having a program work with the local Meals on Wheels program is something that I highly recommend. As for recommendations for the study in this program specifically, I would try to get a larger group, but that is dependent on those who are willing as well as funding. But I also think it is important for this study topic in itself to look at other coexisting diseases such as mental health and how that may impact their willingness to participate or willingness to work with their diabetic diagnoses. These are my references, and thank you so much. I enjoyed this program quite a bit.